Hi, my name is Chris Carter, and today I will be um, properly demonstrating how to scrub in for a surgical procedure. The purpose of the process for scrubbing in for surgical procedure is so that um, any doctors and nurses um, participating in the procedure or being involved with the procedure um, maintain, it is important for them to maintain a uh, aseptic technique, and to be free of debris and germs and things like that. Um, the first step in um, the first step of this process is to remove all of your street clothes. So, your shirt and pants that you wore to work, you remove that and put on your scrub clothes. That is, if you don't already have your scrub clothes on when you get to work. You want to make sure that your clothes are lint-free. So you want to make sure that they're free of lint and whatever else may be on them. You want to make sure that your shirt is tucked in, and prior to having done this, you want to make sure that all jewelry, rings, watches, bracelets, earrings, things like that are removed. Okay, you do not want to take any of that into the operating room. The next thing you do after having done that is to put on your surgical shoe covers. And your shoe covers look like this, and they are designed to, you put them over your shoes, obviously, and they are designed to reduce the contamination from any debris that you could track into the operating room with your shoes. So you put your shoe covers on. Okay. Now, having put on your shoe covers, you then go to the scrub room, where you will put on a couple of things. You will put on your surgical cap, and you will put on your surgical mask in the scrub room before you wash your hands. When putting on your surgical mask, there are two kinds of surgical mask, and both of these kinds have two kinds as well. There is the ear loop surgical mask, which has two bands, one on either end, that these bands go over your ears, and you pinch the nose piece and stuff like that. Then there are the surgical masks that tie. And these surgical masks, both these surgical masks, have two kinds as well. There is just the regular standard procedural face mask, and then there is a surgical mask that has a special mechanism to it. These surgical masks are anti-fog, or an anti-fog, and these anti-fog surgical masks have, on the inside of the nose piece, on the inside of the mask where the nose piece is, they have a strip of foam that not only provides comfortability, so a comfortable fit, but also this strip of foam, when you exhale into the mask, the strip of foam prevents the condensation from going up and steaming up your glasses or your eyeballs or whatever. And then, like I said, there's a standard procedural face mask. Putting on your surgical mask. Or rather, well, you put on your surgical mask, but you're going to put on your cap first. You can put on your surgical mask first and put your cap over that, but most doctors and nurses prefer to put their cap on first and put their mask on after that. There are two kinds of caps. There are ones that tie and ones that don't. The ones that tie, typically the ones that tie you see that look kind of like this. It's basically a skull cap. These kinds of caps are meant for doctors and nurses with short hair or kind of medium length hair, where basically, like for girls with kind of like medium length hair, they can put their hair back in like a ponytail or a bun, and when they put this over their head, their hair fits between the strings, like, they tie it, and this bit right here, this bit right here, this area here, their hair, when they secure the ties, this right here holds their hair, so it holds their hair back. And then there is another cap that can either tie or not, and it is called the bouffant cap. And this cap is very wide, and it's typically meant for men and women with much longer hair. And basically this one has ties. As you can see, it's already tied. It has elastic in here in the back. And what this elastic does, some of them, the ones that don't tie, have elastic like all the way around it. And you just basically fit it over your head and tuck all your hair inside and, all that. This, you take your hair, pull it back, and you basically tuck your hair into the back of it and secure it in the back with the ties. Okay? So here, so you put your surgical cap on, and you tie it in the back. Okay, and you make sure that your hair is all your hair is tucked in, okay, into the cap. Then you go ahead and you put on your surgical mask. Now, this is an anti-fog surgical mask. Most surgical masks, unless they're plain white, most surgical masks come with a colored side here and a non-colored side here. Right here, what you see here on the top is the strip of foam that I talked about. This is the anti-fog mechanism that I talked about here. And up on the top of the mask, there should be a wire nose piece. Okay. Both sides of the mask, most surgical masks have what are called pleats. They have pleats on both sides of the mask. And on the colored side of the mask, what you'll notice is that these pleats go down. Okay, so they're one on top of the other, and you take the mask, okay, you put it over your nose, and you bend the nose piece. You bend the nose piece to your nose, okay? So you've got it like this, okay? Having done that, you take the top strings, you tie them securely at the top of your head, at about the crown. Okay, pull it down a little bit. Okay, then you take the bottom of the mask, grab hold of the bottom of the mask, hold the mask down under your chin, and you take the bottom strings, you tie them at the back of your neck, okay. Okay, so now you have your cap on and you have your mask. Once you have done that, you then wash your hands. Okay? After you have washed your hands, you then go ahead and you put on your sterile surgical gown. When putting on your sterile surgical gown, you lift the gown up, okay? You hold it away from you, you grab hold of the neck area, okay? And then you let the rest of the gown drop. You go in with one arm, okay? Not putting your fingers all the way through the cuff of the sleeve. Then taking the other arm, you do the same. Okay. Again, not putting your fingers all the way through the cuff of the sleeve. You want to make sure that the gown is over your shoulders. Okay. Okay. So you have put your arms in. Okay. So you're like this. You are going to put your fingers just a little bit through the gown of the sleeve, or the gown, the cuff of the sleeves, and you are going to, normally an assistant, normally a doctor or nurse, would help me secure this in the back, but my assistant is not here, so I'll go ahead and tie. You tie the top strings first. Once you've done that, then you tie the bottom strings. You do not want to cross these strings in front of you. Okay, so you tie them securely in the back. And again, normally an assistant would be helping, it would help you with this. Okay, so now you have gowned up. Okay, the last thing you do is you glove up. Okay, when gloving, when donning your surgical gloves, what you want to do is you want to glove your less dominant hand first. So if you're right-handed, you're going to glove your left hand. If you're left-handed, you're going to glove your dominant hand, your right hand first. Well, since I'm right-handed, I'm going to glove my left hand first. So you're going to take the glove, okay? You're going to place your hand in, and you're going to put the glove over the cuff of the sleeve. Okay, the glove goes over the cuff of the sleeve. This is to avoid blood getting on the sleeve and contaminating the gown while you are participating in the procedure. You then take your gloved hand, you pick up the other glove, and you glove your dominant hand. You place your hand in, and you are ready for surgery. Now, having gloved up, okay, you are now ready to go from the scrub room to the operating room. This is the most important step of this process. When going from the scrub room to the operating room, don't touch anything. Okay? When you open the door when you leave the scrub room, put your back to the door, back into the door, and open it. And turn as you go out. Okay? You walk down the hall, or walk to the operating room with your hands and elbows above your waist. You either keep them like this or like this. Do not touch anything with your elbows or any part of the front of you from your waist up. When you get to the operating room, do the same thing you did when leaving the scrub room. You back into the doors, you open them by backing into them. As you go in, you turn and you go in. Once you step into the operating room, you have entered the sterile field, because everything and everyone in the operating room is sterile. You are sterile, the patient is sterile, the equipment is sterile, and the doctors and nurses are sterile. Having reached the operating room, and entered, you have completed the scrub-in procedure and you are ready to participate in the surgical procedure. So once again, my name is Chris Carter, and I just demonstrated how to properly scrub in for surgical procedure.